The show for today. The guest is Dr. CPoe, and the topic is the many faces of despair. And of course, Dr. Poe, we want to give you an opportunity not only to identify the concept of despair, but also to be a little more specific in reference to it. I think you mentioned the fact of language being a part of despair, that there is a language, you say, of despair. Let's talk about that, because I've never thought about despair from any perspective like dealing with language. Go on, let's talk about that.
Well, as I said before, despair is widespread and has many faces or many manifestations. I've come to recognize that despair has a language. There are certain things that people say who are in despair. For example, I don't care anymore. Nobody's gonna tell me what to do.
All right.
I'm gonna do what I want to do. I'm grown. So that's some of the language of despair. Also, people who are in despair are characterized by certain beliefs, and that is that they have a right to do what they want to do.
Okay.
That they have a right. They believe they have a right to do what they want to do, that they have a right to go where they want to go. They even have a right to take advantage of other people, okay, if it advances themselves. So that's basically a kind of a thumbnail sketch of some of the language of despair.
Very good. Let's talk about despair, Dr. Poe, and the connection between despair and mental illness, because I think that that's a very, very popular topic today, and let's talk about it.
Well, okay. Oftentimes, mental illness is preceded by guilt. And we know that guilt is either false or true. Now, oftentimes when people are abused early on in life, they blame themselves. And that's what we would call then false guilt. But now, if that guilt is not resolved, that person can easily enter into a condition of despair. And once in a condition of despair, the manifestation may be increased anxiety, panic attacks, insomnia, irritability, mood swings, paranoia, hearing voices, seeing things, delusional thinking. The person may feel that he or she is superior to other people. They may have delusions of persecution, that people are out to get them. They may have delusions of being controlled by forces outside of themselves or controlled by another person. They may have what's called nihilistic delusions, where they believe that the world is coming to an end in a few days. So delusional thinking, for example, or psychotic symptoms are often manifestations of despair.
And so, Dr. Poe, it's so very, very widespread that it's almost impossible to characterize what it is, because everything that you see each day, you know, even dealing with the language, sort of reminds you that these individuals are, according to what you're saying, are either in despair or they are what? Going into a state of despair. Is that what
Absolutely. We're going to give some examples of some other faces of despair. I believe that sagging, you know, what our young people are doing now, walking around with the pants half off, I think that's a manifestation of despair. Gang involvement, I think, is a manifestation of despair. Hate crimes, hate, racism is a manifestation of despair. Persistently taking advantage of other people, okay? Sexual promiscuity, a manifestation of despair. Oftentimes alcohol abuse or alcohol addiction, drug abuse, drug addiction, the persistent craving of food, in many cases obesity, may be a manifestation of despair. Domestic violence, road rage, workplace violence. So you see, despair has many manifestations.
And I think we all recognize these manifestations of despair, but I don't think we ever completely put it together and say that unless this individual can be changed from his attitude and et cetera, that something not good is going to be a result of that attitude. Would that be correct?
Well, that's true. If a person is in a condition of despair, their thinking is distorted, as we said, Despair distorts a person's beliefs. It also renders them motivated to pursue pleasure. In other words, the world says the answer to pain is pleasure.
Okay.
If you're in pain, just find a way to experience pleasure. The Bible says that the answer to pain is God. The answer to pain is trying to live your life pleasing to God. And so the Spirit of God then resolves your pain, resolves your despair. And by the way, one of the characteristic features of despair is deep pain. People in despair are hurting on the inside. Now, oftentimes they may not even be aware of the fact that they're hurting, but they are. And so hurting then pushes them, drives them to pursue pleasure, and that often results in to relieve the pain.
Okay.
To relieve the pain, and that often drives them to engage in self-destructive behaviors, alcohol abuse, drug abuse, violence, overeating, staying up all night, getting involved in a gang, okay, engaging in other destructive kinds of behavior. So yes, if you're in despair, you're in pain. And being in pain, you're prone to seek pleasure as an answer to your despair. And by the way, despair has a positive side.
Okay.
The positive side is that to the extent that it hurts, despair hurts, to the extent that it involves feelings of hopelessness and helplessness and worthlessness and powerlessness, to the extent that the person often has an urge to hurt themselves or maybe somebody else or both, it's a wake-up call. It's a wake-up call. It's a warning. It's a message. You need help. You need to get some help for your condition. So fortunately then, many people in despair for the first time will turn to God. Okay, to overcome the despair and the pain of their despair. Okay? Unfortunately, some people will turn to alcohol and drugs, as we said, or turn to sex or food, or if they're already have an addiction, they'll get more into the addiction. So despair then has a positive side. I believe God allows despair so that he can use it to get the person's attention who needs to turn to God or draw closer to him.
Okay, and Dr. Poe, let's take this final commercial break and we'll come back and we'll talk about some of the answers for this kind of despair that we're talking about. And of course, we'll be back with our audience following this very, very short commercial break.